Hi, everyone. I think we're live, and this is Skits and Scones.
I'm Skits and Scones.
Yeah, with Kate and Kerry here, and we've got Joel Harden with us today. He doesn't really need much of an introduction, but if those of you may not know who he is, he's a Ottawa Centre MPP representing the NDP party here, and Kerry and I are from Ottawa, for those of you who don't know, so we've had the absolute privilege of having him in our corner for the last few years, and we look forward to many more years. This is Skits and Scones, so I think before we get started, I think it's good to show that we are with scones once again.
With scones.
We made sure Joel had some so he could join in on the fun. And
it's delicious too, Kate. They're absolutely delicious.
Good. Are you into the lemon blueberry? I suggested that.
Yes, indeed.
All about the lemon blueberry. All about the blueberry.
Joel, I don't know if you want to say a few words before we kind of jump in. And
sure. I mean, sorry, stone bite there. I guess I'm here to listen to the conversation you and Kerry are about to have, but I just want to say for the record, it has been quite a journey the last 2.5 years, and obviously the last year has made it like taking it into another warp speed area of advocacy. And I'm really anxious to find out from both of you of what's on your mind and what's on the mind of people watching this as we think about how to advocate for people with disabilities in this moment. It's quite a time. It's quite a time, and there's some strategic decisions to make. There's some demands autistic people have. And folks who love autistic people have, and I want to better understand them. So I'm here to listen, but I'm also here to troublemaker with both of you, as we've been doing for a while now. So, and if anyone hears noise in the background, it's probably because our puppy is chewing on something on the ground. Hopefully not our couch, but there you go.
Are you able to show that beautiful puppy again?
All right.
I'll show you the puppy, Joel.
Yeah, let's come on over here. Hold on 1 second, everybody. 1 second.
I think it's important that we start with puppies. I think that works well. Here he comes, here he comes.
She's quicker than me, and she just ran outside. So there you go.
All right, well, maybe later she'll be back.
That's right.
It's been a while since we've been able to see you in person, Joel. As I mentioned, Kerry and I have had the great privilege of having you come out and join us for so many of our rallies and protests and other events that we've thrown, and that's been great. And obviously COVID has sort of taken away our ability to do those kind of things. One of the things we'll probably get into later is other ways, maybe suggestions that you could give us that we could properly advocate at a time when we can't get together and, carrying signs and chanting and doing all those wonderful things that we did. So we'll get into that later, but Kerry, why don't you go into our first topic?
Sure, let's talk about it, because there is a lot to talk about, so we may as well get started. First, I don't know if we actually mentioned it, but what's important to know here is that Joel is the critic on the NDP side for accessibility in persons with disabilities. So, I mean, as a community, we've been very focused in on Monique Taylor for a long time as our critic that's represented our program and the OAP and has standing up for us in the House. And more recently, it's switched to Teresa Armstrong, who I've had the pleasure of meeting online, and she's lovely. And I believe we're going to be talking with her at some point, or someone from the OAC is going to be talking with Teresa, and I'm anxious for everybody to get to know her as well. But Joel, the work he does sort of skates alongside what Monique and now Teresa were doing. So we like to rope Joel in, not just on OAP issues, because we don't begrudge Joel at all for not knowing all the little details about the OAP, because there is a lot to know about the OAP.
Oh, yeah, absolutely.
There's all these other issues that have been on our minds, and of course, like recently, things have changed a lot, and maybe our focus on things have changed a little bit because of COVID. we've always been very, very honed in on the OAP, but things like vaccines and access to healthcare and kids in education and housing, and there's all these other things that that may be on the minds of parents, maybe parents with slightly older children who are about to age out of the OAP. So we're going to start with the OAP though, just to maybe talk about it and get out of the way, because we, mind you, I wish it was out of the way. It's going to remain right there in the forefront for a long time, I think, which is unfortunate. So where are we at, everybody? Like in terms of the OAP, on February 3rd, I think it was, we heard from Minister Smith, and he told us that needs-based therapy was here. It is not. It is not here. What they are doing at this point is they are moving forward with a pilot program. And the important things to know about this pilot program are that we do not know what it's about. We do not know who's involved in it. We do not know how long it's going to take to roll out. We don't know if the findings of this pilot are going to be shared with us. We know also that there is no, what am I thinking of, Kate, right now? The mechanism for parents if they don't like the way it goes.
Needs-based determination tool.
Oh, sorry, it's the tool, yes, that they'll be using, but there's no mechanism in place to, what is, the word is escaping me right now.
Oh, the intake.
The appeal, that's what I'm thinking. It's the appeal process. There is no appeal process for families who are entering this. So this, I mean, we have been able to connect with some families that have been invited into this program. Todd Smith talks about 600 families being brought in. We've identified maybe a dozen of them.
Not even.
We learned recently that the promise that was made that they would bring 600 in within the month of March was missed, Kelsprees, and they've only brought in 200. So we're at a point right now where we're trying to find some of these families to talk with them and to more or less sort of gauge what's going on, because we're really concerned about this process, especially without an appeals process in place and so little information. This government has currently sort of touted being transparent, and this whole bit with transparency. I'm going to just hold up what they are calling transparency. So this, if you can see this is what this government is calling transparency. So every month, on the 15th, and they're on time with this. This is the one thing that they are always on time with. On the 15th, we get these numbers. Now, I know you can't see what the sublines
you can see pretty well. You can see pretty well.
Okay, perfect. So I don't know if Joel can, but, and now I've lost my light. So this top number, 46,169, are the number of kids that are registered for the Ontario Autism Program. The next number, the 11,447, are kids that have received invitations to childhood budget. So the previous program that Lisa McLeod had implemented. And then we have 30,615. And those are kids that have received invitations to a chunk of funding that is based on age and nothing more. Not need whatsoever at all. So that those numbers add up to 42,062. Now, Joel, you might remember, I'm rambling a little bit here, but I've got a lot on my mind. You might remember sitting in the House, I don't know, early 2019, and hearing the number 23,000 reiterated over and over and over again and over again. Like we have nightmares about that number. If I won the lottery, if I got, was given $23,000, I'd give it back. I don't want that number. It's a terrible number in our mind because we heard it so often. But now that number is more like 43,000 after, and I just did a little math, it's been 793 days since that program was implemented. And maybe important to note as well, the OAP the wait list was frozen about 5 months before that. So let's add 150 to that 793. So it's been almost 1,000 days, 1,000 days since a child has entered the OAP into a needs-based program, a program where kids are cared for, where someone is following them, where families can touch base with someone. And basically expect to get what their kids need. So there's a lot of numbers that are being thrown around right now in terms of, oh, we're helping this many, or, oh, we've helped this many. And yes, families do have these chunks of funding in their pockets right now, but they have nowhere to spend it. So, and that's because of COVID, but that was also because this government was ignoring our screams about capacity issues before a pandemic hit. So, I mean, I don't know what more to say about this right now. Like, for a government that talks about transparency and talks about supporting families in a way that they've never been supported before. That's true. They've never been supported this way. They've been supported in ways like, my son is in a needs-based program. Kate's children are in a needs-based program, but it has been 1,000 days since anyone has entered a similar program. And what these people have received, if anything at all, is basically a check that says, have fun.
Figure it out on your own. Figure it out on your own.
You got your $5,000, see ya. Never mind that you have nowhere to spend it. Never mind that it's that much harder that will be in a setting like this, where there are so many limitations. But we haven't seen any action on this at all. And I think we forget that, because when we see that money come in the mail, these are people who have been starved for something, right? And when you get a $20,000 check in the mail, and for families who haven't really, who have never accessed therapy before, who don't really know maybe the financial commitment and cost to what these things actually, like the price tags of these therapies. $20,000 seems like a lot of money, but when you get going, it's gone pretty quickly.
Yep.
I don't really have a question in here, Joel. I'm just ranting is what I'm doing it.
I think what you're painting a picture to me, Kerry, that echoes across so many different needs in our province beyond autistic kids, autistic adolescents, autistic adults. It's this government on this issue and so many other issues, and I hope to never be like this if I'm in government, has become a victim of its own ideology. And a core part of that ideology for a certain kind of conservative, I don't even think it's fair to say for all conservatives, but for the conservatives leading this government, it is a fend for yourself ideology. As you said very well, what did the former minister responsible, your MPP, the Honorable Lisa MacLeod, what was her contribution beyond saying 23,000 all the time, talking about the size of the wait list? She blew up the infrastructure of autism services that existed. She asked CHIO, our children's hospital in our city, to install, for the first time in its history, a payment capacity to access its program. A lot of therapists left the sector, a lot in the midst of this chaos. And I don't want, when I'm sitting in that green leather chair, if I ascribe motive or call someone a liar, I get thrown out of the chamber. But what other conclusion can I draw when I see someone tell you, tell Kate, tell so many other parents, tell autistic kids, adolescents, and adults, this is all you're going to get. This is all you're going to get. Eat your lima beans, right? We heard that for months, right? Eat your proverbial lima beans. But then you folks organized, and that person lost your job and has been shuffled off into a ministry more appropriate for her ego, right? But what has advocates had to deal with in the interim? That's the first thing. I just want to say, big picture of what we're dealing with here. We're dealing with a government that really believes it's a fend for yourself world out there. And I mean, what I want to say just off the top in our scone chat is that it's not only up to us, I actually want to make a plea also to conservatives. Take your party back. Conservatives built public power in Ontario. I was raised by rural conservatives. What's happened? What's going on when your fundraising for leadership campaigns depends upon religious bigots and people who think some people don't have a right to even exist? This is what happens to your party, sadly. You start thinking certain people are disposable and an obstacle, right? So I think, candidly, because I want to speak candidly and honestly with you, what happened with the last cabinet shuffle when Minister Todd Smith became your minister is that the government is trying a soft sell approach right now with you. And apropos their ideology, dishing out checks and doing incrementalism as a strategy for autism supports right now. And I agree with you, it is insulting. I mean, when a family who's been suffering financial hardship, emotional hardship, lack of respite care, all the things I've learned from you, gets a $5,000 check in the mail, it's no trivial matter. But figuring out how to cope on your own is not as good a strategy as trying to get dollars into the hands of institutions and community networks that can actually provide children with the care they need, whether it's after school care, intensive care during the day, respite opportunities, anything. Like we know in our city in Ottawa, there are community builders who've been establishing these networks for years. Some of them are in the public sector, some of them are in the nonprofit sector, some of them in the private sector, but they're doing great work. When you just give somebody a $5,000 check, it's not automatic that that person will know where to invest it or what to do, right? But this is, sadly, this is a case of the government being a victim of its own ideology. I also, because you mentioned the work our office in Ottawa Centre does, not just for constituents here, but provincially around disabilities and accessibility, Kerry, I also just want to say this is apropos of an approach of a government who has sat on a report from its lead investigator on accessibility issues, the Honourable David Onley, for as many days almost as people have been waiting for a response from the Ontario Autism Program. The Honourable David Onley has been waiting, urging this government to act on a damning report that shows how ill-prepared we are as a province to meet our accessibility obligations. I want to make that clear. It's not a target, a hopeful thing one might achieve. We have a statute in Ontario, it's called the Accessibility for Ontarians with Disabilities Act, and it says Ontario must be fully accessible by the year 2025. And the Honourable David Onley said very clearly in the realm of education and children's needs, we are vastly behind targets, right? And every time someone says to me, oh, well, I guess we just have to kind of laugh that target off, I'm always one of the first people to say, no, absolutely not. Absolutely not. Like, if this government doesn't want to do its job, whatever government comes to power next June has to have a hurry up mentality of saying, like, what are we going to do to get dollars into institutions and programs to help families, and not tell families, here's your check, you're on your own, right? That's been their approach to childcare writ large too. You know, not put money into childcare spaces, institutions, largely women who have built up this sector for years, whether it's in their own home or in an institution. No, it's been like, here you go, family, take your, as the pandemic has shown, take your $500 per child, take your $200 per child, figure it out, right? And if I have a plea of anything across party lines, it's we have to take objection to that strategy. We're better than that. We have a better province, a better country than that. We know that the way you help people live more meaningful, affordable lives is you have some cooperative, collective solutions. We can have a debate over the size and scope of those. That's fine. But this individualistic, bend for yourself mentality is I would say, Kerry, it's the biggest obstacle. And it applies to the Ontario Autism Program. It applies to almost every other exceptionality learning challenge that I'm familiar with kids having. Just so you know, and folks watching this know, the Ontario Human Rights Commission is going to be coming out very soon with the findings of its commission into dyslexia and the barriers that poses to dyslexic kids in our system. It's the same story. We are lowballing investments. ADHD advocates. I am an ADHD person, right? We know they have been asking for the same right to learn opportunities for those kids. Down syndrome's advocates. We can go on and on and on and on. The end of the story is a government that would rather cut checks and shed responsibility. So I'm anxious, this is me putting on my partisan hat for a second, I'm anxious to be part of a government that will not shed responsibility, but will open up dialogue with folks like you, folks who know, and people watching this, about what kind of institutions, what kind of networks, where do the dollars need to go so families actually have choices, people actually have real choices that are well-funded. So you know, if the current government doesn't want to, wants to fritter around with pilot projects, I think they're basically just etching the epitaph of their government, that people are going to be resisting that. That's not what I'm hearing. people say they need and want. We can do better.
Right.
Well, after
Kate?
2 years, you would think we'd have more than a test pilot is all I have to say, really. I'm looking at, we're getting lots of comments here. Tamara has come up with a good question that seems to be coming up time and time again. Is the OAP in the wrong ministry? Should it be under the Ministry of Health? What do you think about that, Joel?
There's a compelling case for that. There's a compelling case for a standalone sub-ministry within education. You know, like these are not in government. My experience when I talk to friends of mine who've been in governments, like as elected people, is that you're under such timely pressure to respond to things in the moment and to create the spectacle of having done something and doing something. Everything is ad hoc, right? Everything is ad hoc and just slapped on by the like many layers of duct tape. So I love duct tape. It's a great Canadian invention, but do you know what I mean, right? What we need, because we have them, Kate, we have them. Like what we need are the people who are responsible for creating the institutions that we have, chugging along as they are. They need to be sitting down with policy people, with elected people, and with community advocates to say, okay, what can we accomplish in the next 3 years? What institutions need to grow quick? You know, how do we get those dollars to you? And then we need to advertise and promote and let people know what their options are. So we take the burden off the individual family, right? And we also need to speed up, as you know better than me, the whole testing process and the whole testing regime, where families are not in this. Just, it's like a caste system now in our public school system, where if you can afford to get your child privately tested, then you know how quickly you have to act at early ages. But there's a whole lot of people watching this and a whole lot of people in our province that do not have that luxury. They do not have that luxury. Through you, we held that amazing roundtable 2 years ago, a year and a half ago, in the boardroom around the corner from our office, constituency office. And, you know, there were families who were eking out a living, and that's charitable, on the Ontario Disability Support Program. People who are permanently disabled, who have autistic children, who are saying to me, Joel, I don't know what I'm going to do. I'm on the wait list, and if I get money, okay, great. But like our family lives in poverty. Our family lives in poverty. If you give us money, like we need money to survive, right? So there's an issue there of making sure people who have like debilitating conditions can live with a decent income. That's one piece. But then the other piece is, how do you give a family like that a real choice? You know, and I would say it's in creating a well-funded option for their child to pursue therapy, be it through a practitioner or through CHIO or through some other community agency, you know, public, private sector. I've got an open mind, quite frankly. I just know the need is astronomical, and people in my profession are playing games, and I have no interest in that. Like I would love to be a minister in a government that brings a disability lens to everything, every single thing. Because when I read David Onley's report, that's what I got. Whether it's the way buildings are built, the way we do education, the way we do healthcare, the way parks are built, the way streets are designed, everything needs to have a disability lens, because everybody in Ontario, either now or at some point in our lives, are going to have a disability. Every single one of us, right? But we don't behave that way.
You bring up a really good point. Sorry, you go ahead, Kerry, actually.
No, I was just, no, you go ahead, Kate, go ahead.
Well, I was just going to say, as to what Joel was saying, you know, if we bring it back to the OAP, what has always bothered me about them not giving people enough money to meet the needs of these children is that, along to what you were just saying, Joel, is families that are wealthier can take the little bit of money that the government is giving them and then use their own money to help them actually put together a therapy program.
Right.
Or they have a house that they can remortgage. They have the privilege of putting themselves into a great deal of debt.
Right.
Not many people have those kind of privileges. So once again, you're looking at families who have those privileges are maybe better able to support their own children, whereas families that are struggling, they're being given $5,000. Well, there's no way that they can afford an ABA program with $5,000, especially not even a minimal amount, because you have no idea when the next check for 5,000 or 20,000 is coming with this government. There's no organization or timelines. So it is atrocious to me that families who are more marginalized are basically completely locked out of helping their own children. And what kind of guilt and stress does that put on you as a family? The children's needs aren't being met, and the stress of that has to be astronomical, you know?
And then put a pandemic on top of it. Kate,
Yep.
Joel had said two words that sort of stuck in my mind, and those two were, well, phrases and words. The first one was hurry up, and the second one was accessibility. Now, when we're talking about hurry up, I think like we need to continue to drive home the fact that there are families who have been waiting for more than 5 years for some type of meaningful support, right? And the fact that this government has been sort of dragging out this process, saying, oh, we're making these promises, we're trying to get it right, we're coming up with a program after nearly 1,000 days here. We're only at a point where we're doing a pilot program, and we know very little about that, or what where we're headed with that, or how long that's even going to take. We really need to acknowledge, the kids that have, like, the lost generation of kids, right? That will have waited, who will have outweighted the age caps that have been implemented. And we need to talk about solutions for these families who, they've been on a wait list, these kids, for 75% of their lives to access something. And by the time they cross that threshold, the opportunity will be gone. So the very fact that it has been dragged out this long is truly abhorrent to me. Like, yeah. It's disgusting is what it is. We can be idealistic about crafting a program that, there's a lot of problems with what's going on here, ignoring advice and whatnot, but to craft this program for kids that'll be born years from now. But we also need to recognize that the wait list that has been created here while they're doing it. I'll come back to this, Lisa McLeod preaching about the 23,000 on a wait list. They have doubled that wait list. There is twice the amount of kids waiting to enter a meaningful program, and it takes a special kind of government or person to double the funding for something and double the wait list at the same time. Now, I just want to link this in here. This week in the House, I think it was this week, member Jeremy Roberts was speaking to the OAP. And I had showed you those numbers there, and online it'll say that 42,000 kids have received invitations to this age-based funding. In the House what day is it today? I don't even know what
this has been a constituency week, so that would have been last week. But yes, I remember
last week.
Rose.
Okay.
Yeah.
So he mentioned that 34,000 children were receiving support. Now that sets off some sort of spidey senses to me, is what that does. Because on the government's website, they're talking about 42,000 invitations being issued to this funding, and yet 34,000 are accessing it. And so this brings me to accessibility, marginalized communities. Where are those other 12,000 kids? If they've issued 42,000 invitations for this funding, if we want to talk about, having the privilege to know where to go with this money, or, knowing what to do with it, or like even being able to read the letter that arrives in the mail, where are these extra 12,000 kids? That's my big question. To talk about 34,000, this is a number we haven't heard before. This government hasn't talked about the number of kids who have actually received funding. And I'm glad that Jeremy said that, because that prompts a whole bunch of questions in terms of directing our advocacy. Where are those other 12,000 kids? Because right now we have families who have nowhere to turn to ask questions to.
Absolutely.
The way that things go right now is we call a number and talk to a faceless person to get a random answer about something. And if we call back the next day, it's a different answer. Our community has been forgotten. I mean, we could pick apart the OAP all day, but I think broadly speaking, we need the government to hurry up. What they are offering is nothing to be celebrated yet. And we need to ensure that families are able to access therapy during a global pandemic, but even, you know, if I want to think forward to a world where there is no COVID-19 anymore and it's not an issue in the forefront of our minds, what's going to happen after that? We are bringing a promised 600 kids into a pilot program with no duration and no timeline as to what to expect. Remember, everyone, 46,000 kids in this program right now. They'll have to be bringing them in hordes. When the new needs-based program arrives, and it has not arrived yet, you will be waiting, is the point. And we need to urge this government, or whoever happens to be in power in 2022, to hurry up and come up with solutions, to organize. This is always the word when I think of you, Joel. Joel's favorite, I hope Joel's favorite O word is Ottawa, but the second one, organize. This is
Right.
it's disgusting is what it is. And I don't have a question. This is just,
No,
these are my feelings on this.
I dig those feelings. I mean, I think the powerful question you're posing, Kerry, is where are those families who are not, getting any support? And I have many gut answers to that because we've met them when, autism events are held and they find out about them on Facebook and they find out I'm a politician and they'll come and they'll talk to me. This is pre-pandemic, none of us are wearing masks. We're all thronged together. And you see mom or dad there with beautiful kids who are, being themselves, right? But you get a picture of what it's like living in that small apartment all day long. You get a picture of what it's like, walking a minute in the shoes of someone else who's trying to be the best parent they can on a minimal income. As you say, maybe there's language issues, maybe there's all kinds of needs in that home. So that, I think that is an excellent question for MPP Roberts is, have you given any thought to people who aren't getting any support at all? And then I feel the need to take a step back because I want to be, again, as honest as I can in our conversation because of how much I respect both of you and people who are driving the autism needs movement. I feel as if a lot of the impasse is political and we have to dislodge it from all of our parties. When people like me, and I'm going to make the assumption many people participating in this conversation online say things like, we need an ambitious program that makes sure we have needs-based therapy to all who need it, right? We are talking about, according to folks I've spoken to, a significant expenditure. And the immediate obstacle you hear from politicians is, how can we pay for this, Joel? How can we pay for the kind of institutions you're talking about? The government during COVID even is running a deficit in the billions. I mean, I always say to folks, when it comes to disability rights investments, because that's how I see them. I don't see them as spending. I don't see them as a deficit. I think it's like, this is an investment now to make sure that people can live meaningful and fulfilling lives. And I get on the phone every day usually, and I call randomly through the riding, anybody who's been in contact with our office. And I'll talk to affluent people, I'll talk to people on fixed income, seniors, younger people, all kinds of people. And when I do talk to affluent people and I tell them, you know what, you and I, because I'm an MPP, I make good salary thanks to people volunteer, you're not gonna have to pay more taxes to get out of this. Like at some point, we have to get past this impasse in our politics where it's not kosher to talk about tax increases for people who are not super affluent, but are affluent enough that they diligently pay their taxes every year. Like we don't have a special accountant or a special lawyer to park our money in some numbered account in some sunny destination. Like that's not what most people do. We work hard, we pay our taxes, but we have not gotten to the place where we can say, you know what, if you want a more enabling province with a real needs-based program, not just for autistic kids, but for dyslexic kids, for ADHD kids, for every single special need and exceptionality, we're gonna have to pay for that. There's no way around that. And when I've had the conversation with folks, it's like, do you want the extra $5,000 in your pocket for some investment, or do you want to invest it in your family and every single other family? Because I've just talked, frankly, I've talked to too many low-income families whose kids with disabilities, the needs don't get met and they end up in trouble, right? Serious trouble, corrections trouble, like crisis and trauma trouble, mental health and addictions trouble, right? And that's like, it's Senator Munson has said, pay now or pay later. But I actually think even in the now, it's more expensive. Even in the now, it is vastly more expensive to give someone a $5,000 check and say, figure it out. Because really, what kind of reprieve is that family getting? What kind of help is that kid getting? Whereas if we actually said, 46,000 people, $5,000 each kid, what could we build with that money? That's how childcare advocates work in Quebec. That's what they did in Quebec. They said, okay, look, we're going to make a childcare system well-funded at the institutional and provider level that's based upon how many families have the need, right? And they built, it's not a perfect childcare system. There's lots of problems, but it's a system. Like, people have a choice. They're not like in Ontario paying $2,000 a month or $2,500 a month per infant, per 12-month-old or whatever it is now. That's I feel like we have to take a step back and say to ourselves, running the next election, let's be honest with the people of Ontario. We're going to affluent people, super affluent people for sure, but I have my doubts about whether they will actually end up paying their fair share. I'm talking about the average person maybe making a salary between $90,000 to $200,000 a year, very well off folks. You're going to end up having to pay a little bit more. But what do we get out of that? A straight conversation. When I looked at what Bernie Sanders did in the United States, that's what his Medicare for All plan was. He was attacked by people in his own party for saying that. But he said, look, the only way we're going to climb out of this tragedy that we have is if we're honest with people and say, you can either pay the copays now, you could risk financial ruin now if you get sick, or we could all look after each other. And like, I want to see Canada look more like Denmark. I want to see Canada look more like places in the world that actually have supports for people with disabilities. I've been looking a lot at Australia lately. Fascinating. The disability rights movement is so much more advanced there than here. And it's because this is, as I understand it from friends over there, they've prioritized institutions and community-based organizations that can help a variety of people. They haven't just individualized the issue of, here's your check.
Yeah,
Here's
the
your tax
silos,
credit.
right? And speaking of which, it's funny, Kerry and I said we would just touch on the OAP. But here we are, just looked at the time, and we've been talking about this for quite some time, and we could keep going, I'm sure. But there are a few things that I know we want to discuss with you, Joel, and I think this is a perfect time to sort of pivot towards education, because you would like to think that it could work in conjunction with the other supports that children with disabilities have, but it does seem to be completely on its own, and it, in my opinion, is failing. And we've just learned recently that there's going to be cuts again next year. How is this possible, Joel? I'd love you to tell me how we can go from, we're in the middle of this pandemic. Mm-hmm. It's rough on everyone. We've already established it's extra rough on children with disabilities who are out of the routine. Mm-hmm. Many families like mine are not even sending their kids to school this year because the supports were really not in place for them to be able to succeed and for us to feel safe with it. That being said, we're getting through. I know I have a lovely school and they're doing everything possible to support us from home. But how can we realistically look at September and go, oh, okay, I guess we're sending our kids back to school and everything's going to be normal again. They're going to be making major cuts and there's going to be way less people there to support our children, but I'm sure it'll be fine, right? Is that what they're really thinking, Joel? Is that their philosophy there?
So let me, again, just try to speak plainly here and say, I think the current government looks at this moment as an opportunity for them to push something they've been wanting to push since they walked into office, and that's more online learning for everyone, because they want to shed employees. They look at the Ministry of Education and they look at labor costs and they just see it as numbers on a balance sheet. And they're using our kids as lab rats, quite frankly. They're using our kids as lab rats to decide, okay, how can we find moments when families are desperate and want some reprieve because they have to work and they're working from home, how can we get them to really buy into more online learning? I remember the first time I heard Minister Lecce talk about what the goals were for the Ministry of Education per day for online learning. And he said 6 hours of synchronous learning, of sitting in a chair and staring at a screen. For somebody, myself, grew up with impulsivity issues and hyperactivity issues. I was like, this man has never raised a child. This man never went to public education, at least at the high school level. Like, he has no clue, nor does his parliamentary assistant, MPP Oosterhoff. They have no idea what families are going through right now. Zero. And they're just looking at it as an opportunity. Every single public health officer that declares a Section 22 and shuts down public schools because they're concerned about community spread in the community for understandable reasons, quietly, I believe this government is applauding. They're thrilled. Someone else made the tough decision, and now we can experiment on kids with slipshod online education. Now, I am not saying online education is bad. It's actually great for many. I've talked to kids and I've talked to families for whom, like, being able to learn at home through virtual learning has actually been really great for some kids with a lot of social anxiety, for example, who are really adept at technology, who know how to take breaks and all this sort of stuff. But for many kids, it is not working. And all the government is doing is continuing the antagonism they have with employees in the public education system because they want to shed jobs. That's what it's about. And frankly, I actually think between you folks and public education unions, we have a big bulwark of pushback and troublemaking to do in the next few weeks. I completely would support any employee in the public school system if they felt they were working in a community where they were vastly unsafe, and compelled to work. Particularly, I'm thinking about special educators who are now thankfully being vaccinated across the province. That was a lot of great pushback that was done. But I'm thinking about anybody going into the public school system who's being put into that position of, oh, you know, now throw together an online module and back in. Like, this is just a joke. We need some kind of collective action against this government to tell them to stop playing games with us. Because I agree with you. Like, when I heard that COVID money that they announced for this year, the 1.6 billion, was not going to be renewed in the fall, I immediately thought of the mental health crisis, particularly among teenagers in our city, and the admissions into eating disorders, and all of the evidence coming into our office about the crisis. And then I'm thinking, well, you know, what does the minister think? The minister will just keep coming up with these rote, manicured statistics to make the public believe everything in schools is perfectly fine, while we are seeing so many of our young people falling apart right now. And if they actually spent the money, it's just like the autism argument, just like the dyslexia argument, just like the ADHD argument, the Down syndrome's argument, every single exceptionality we were fighting for. If they invested the money to make sure schools could restart safely, and staff felt that their government was actually looking out for their needs, I can certainly say in Ottawa, boards are working really hard. Boards are trying with the resources that they have. But that's what I think is going on, Kate. And I think this government is due for a reckoning. And, you know, I hope before we end it, we could talk about protesting in the digital age, because I want people to know that even though we can't gather in person, and I want everybody to be respecting the stay-at-home order and the maximum of 5 and all the things that we have to stop the community spread. The variants are very, very concerning. But I just want people to know that telling your story and having that generalized across the internet, because we live in this connected world, is making a difference. And I want to quickly point to 2 things I can share with you later so viewers can follow up and actually see the evidence for this. In the last lockdown that was declared on Boxing Day, we immediately started getting contacted by people with developmental disabilities, because aquatherapy for many people who live in power chairs is essential, not just to kind of get a stretch, it's essential for respiratory health, it's essential to live a decent and meaningful life. But we were going into lockdown and we were shutting pools and fitness centers unless you were an elite athlete competing for Canada or Ontario, and then we would keep a certain capacity open for you, but not for people with disabilities. So advocates got a hold of us, and we got those advocates in touch with the media, and we started telling this story. We started pushing super hard And I give full credit to Joanne Lausches from The Citizen and CBC Ottawa Morning and others who helped us tell the story and picked it up. We put so much pressure on the government, we actually found allies within the appropriate ministries who pushed it inside the government. And we got a policy change on February 12th. And that's the case right now in the city of Ottawa. There are pools open for people with disabilities right now. The Nepean Sportsplex is open. If you can demonstrate with the proper medical whatever's, probably a letter from your GP or whatever, that you need this, you can access it. And the city has a safe plan for it. And we need that same model for our schools, for every single person. But that was just one MPP office working with a couple of fantastic advocates, Melanie Coughlin and Mary Jane Clinkard, and there were many more across Ontario. We in the education system, we need a big, unapologetic movement saying, stop experimenting with our kids, spend the money, put the resources in the system. This is not fair. This is not safe. And I can tell you, if you looked at what just happened last weekend with the amount of pressure on the premier in particular, given the way our ICUs were filling up and people were saying, vaccinate essential workers. What are you doing? Right? Like, what are you doing? He buckled. Like you could see, he buckled and said, okay, GTA, Peel, we're going to start vaccinating 18 and over essential workers. And that's a credit to community online organizing. People spoke out. Full credit to Dr. Michael Warner and all of the practitioners who took time out of their busy days to advocate publicly. That's what you guys did. And even though we can't rally, it still works. Like all of these people still have to get reelected. All of these people still have their reputations at stake. And
yeah, well, we do actually have a couple things in the hopper. And one thing I should mention, we just started it yesterday, is a campaign where once a week we will choose. Actually, we have a fun little game. It's kind of you know Rhonda, right? She's one of our moms, our local moms.
Love Rhonda. Mm-hmm.
Rhonda created a wheel of misfortune. Picture a roulette wheel, and her and one of our other parent advocates, Tony, will be spinning it every Thursday night, and it will land on a person, and it will be the next day, which is usually constituency day, and most MPPs are technically supposed to be in their office. As a community, we are going to rally to contact and demand answers to the questions that we're just not getting answers to. So everyone can see on the OAC page, it was Robin Martin was the misfortunate person who it landed on last night. So you can look at our page and get all of her information to give the office a call or an email. But yes, Joel, I mean, we will continue to keep trying to do Twitter storms and as many things as we can online until we can get together safely. I do want to, I can see we're not going to get through everything on our list, Kerry, but maybe we can move to the next thing that you were going to ask about, Kerry. I think it's important.
Not so much asking, but we're talking. One of the things that sort of rocketed to the forefront of my life and became sort of something I needed to pay attention to was advocacy for children with disabilities or individuals with disabilities in the healthcare system. So recently we've had sort of two experiences that stand out in my mind. And the first one, and I mean, I feel for any parent that was quite likely put into this position over the past year, was having to take an autistic child for a COVID test. So here in Ottawa, we are very, very fortunate to have CHIO. And Jack, my poor dear boy, how many times, Pat, did he have to go? Twice or three times? Anyway, he had more than one COVID test. And the first one did not go well. We'll say that. It was traumatic for everyone involved. We weren't well enough prepared. We didn't necessarily have, it wasn't that the resources weren't accessible to us. It's that we didn't, that weren't available to us. It's that we didn't know how to access them and we didn't know what was available to us. So we had a traumatic experience. We'll say
Sorry
that.
to hear that.
No, and that's okay. We expected it, but it wasn't good. It wasn't good by any means. However, we learned through that experience, the second time he needed a COVID test, that we needed to start to look for more answers to make it go smoother, because we don't know how many more he'll need to access. And so we did that. And Pat and I mean, we like to think that we're fairly well-connected people that know about resources in the community, who to call, what to look for. And we had to dig. Was sort of the what I took away from it. We had to dig, and what we found was an amazing response from the people at CHEO. And like, I mean, I'm not trying to discredit CHEO by any means, but it was a matter of preparation, which the ball is in our court for that as parents. But we need the tools to be able to figure out what to do. So the second time that we took our dear boy Jack to get a COVID test, we had the cell phone number of the head nurse at Brewer, and that person was waiting for us at the door, and Jack was accommodated. So we're talking about not having to walk through a building that terrified him, taking him to a private room, having a quick swab, being able to use a back door to exit, do paperwork in a small room, all these wonderful things that I think about, you know, people in other communities that may not have access to CHEO's team. So, you know, we're in a place of privilege, Pat and I, where we know where to look for information. We have places to go to help our kids get tested. It's not lost on me that these resources aren't available to families in other communities. And, you know, I think about kids that would just forego the testing process and then be stuck at home for God knows how many weeks because they had to forego that. And then we fall back into online learning, lack of support, no respite for families, taking time off work, all because we can't safely and comfortably and in an accommodated way go and have our kids tested. Now, alongside that, the second little story that I had to tell that sort of rocketed to the forefront of my life is that Jack was recently diagnosed with epilepsy. So we've had a couple of seizures in recent times. So he's had to sort of go through, we have a new department that's opened up to us at CHEO. And we've been trying to basically schedule an EEG for Jack. And this is something that he can't do sedated, that he needs to be calm for, that which is not going to happen with our dear boy Jack. But this opened up a whole new world of advocacy to me, is dealing with patient advocacy and accessing appropriate supports in a hospital setting. And the long and short of it is as a team that, like Jack's doctors, several departments at CHEO, the patient advocate office at CHEO, we all decided that Jack could not go through with this test, mainly because of COVID restrictions, but that the appropriate resources were not available, or we could not accommodate him in a way that would be necessary for this to be accomplished. And I was fine with that, but that made me start to think about this whole new world of advocacy where I'm talking, like, I've been so honed in on OAP and like learning supports. And I've got to thinking about families that just can't access what their kids need in healthcare, which is just, to me, and again, I'm coming from a place of privilege where I know people, I know who to call, I know, you know, like the numbers to call, the websites to check, and to try to, you know, scrounge up any resources that I could find, and I still couldn't do it. And that spoke to me. Then that got me thinking about marginalized families, or about, you know, and anyway, it's COVID has opened my eyes in a big way, because COVID just exacerbated this issue for us. And I mean, COVID testing sort of just, like that rocketed it to the forefront. That these are things that we have to deal with. And as a mother of 2 kids on the autism spectrum, and one who is getting larger and getting stronger, he needs to access healthcare. And we need ways to be able to advocate for our kids in the healthcare system, because I know, like at CHEO, we have Child Life, where, you know, there's a group of folks that will come and they'll take you to a quiet room or they'll bring your kid an iPad, but child life can only go so far. And really, like, what we need as a community, particularly families with kids with severe diagnoses, where accessing this type of thing is a real challenge. We need direction.
Like a navigator.
And we, you know what we need though, is we need departments within these healthcare facilities to talk to one another first, because the amount of explaining that I had to do from department to department, I mean, that wears on a family. That's just another responsibility that I have on top of worrying about my kid who needs a test because stuff isn't working, right? But anyway, sorry, I'm ranting again, but this is in my mind now. And it's become more of an issue for people, a generalized issue now that COVID is here with testing, so to speak.
I think it's a worthy rant, and it's I mean, CHEO is a fantastic institution, as you say, but it's in constant learning mode. And this is exactly the kind of thing, Kerry, that, you know, for you or for Kate, for anyone watching this, if they want us to follow up with CHEO around anything in particular, please let us know, and we will. I can definitely say our experience working with CHEO is that it's an open door, very easily acceptable of constructive criticism and having a staff to want to actually fix problems. And I think there's a lot communities can do to make institutions better, you know.
Right. And I don't want this to come across as
no.
You know,
It doesn't.
I'm thinking we have all of, like, everything lined up for us. If anyone's going to succeed, it's my family, because of the resources that are available to us at CHEO. But then, you know, you start to think about families who just don't have that, and the bigger issue here. So in any case,
you're right. And when Kate and I were talking earlier today, not to surface any of the details, Kate, but the narrative part of our conversation was we become super advocates on autism, for example, because it's such a focal point given our families. But then other members of our families will take us into new realms of advocacy, right? And this is just when you become a good advocate, your skills are transferable, right? But it just says a lot about you, Kerry, that you're thinking of people who don't have the privilege to be able to do that. So we need, this is again points back to institutional fixes. So for people that do not have the bandwidth for that, the capacity for that, we make sure that institutions are flexible enough to help folks in this. And we've run into residents who've voiced concerns, and we've shared them. I definitely think you're right. COVID worsened the inequalities that were pre-existing, but it also, I will say this, it's interesting. Being the disabilities critic for the province has been an interesting journey, because I think disability rights is one of those cross-cutting political issues that travels well with people who may not think the same as me or you or Kate, right? Like, I think there's a lot of people. I'll go all the way up to the Ministry of Health's lead spokesperson. Minister Elliott is a mom to a son with a serious developmental disability and was the patient ombudsperson for this province. And there have been many moments in this pandemic where I just wanted to scream, because I don't understand why we haven't had a higher prioritization of disability rights in the vaccine rollout, for example, in any number of healthcare related issues, because of her experience. But I know that between Minister Elliott and the service delivery, there's a wall of bureaucracy, there's a wall of politics, there's a wall of all of this stuff that sometimes impedes the right action. But the only way that changes is when we troublemaker and increase pressure and speak out, right? And I definitely think healthcare advocacy is already huge, and it's going to continue to be huge, because, you know, let's just, you know, knock on wood. Where's some wood? The tables of the desk here are wood. We're going to get vaccinated as early as the summer and the fall. Things are going to start feeling a little bit more like where things were, but we're not going back to normal. Normal wasn't good, right? Like, we need to go back to like a more enlightened community that sees big upfront investment in disability accommodations, big, like huge, because our society needs it, and it'll work better if we have it. And the most enlightened members of our society, including the people on this call and watching this call, know it, right? And we can push for it. It's not a foregone conclusion. And one of the reasons I like doing comparative research with other countries and even other provinces is that I can say, hey, it's not pie in the sky. Look, it's happening over here, right? Like we can have more special needs education built into the schools in a way where that kid feels supported right through the whole experience. You don't have to stress out parents to always be on top of the teacher or the principal or the vice principal or whatever. I mean, that's just waste of resources. So I know that we can do things better. And I know the only reason we're having this conversation is because you've pushed this government to do better. You've gotten cabinet ministers fired. You know, you guys have power. You have power and you
I don't know
earned
if
it.
Kerry and I specifically have the power, but I do like that you just referred to us as being enlightened. I like that.
You
What
are.
do you think of that, Kerry?
I enjoy enlightened. I'll take that for sure.
Joel, you just mentioned vaccines, which was the other part of the healthcare thing we kind of wanted to discuss. I know as of the last announcement on Friday, we've got a little bit more, in terms of adults with developmental disabilities may be eligible a little earlier. But is that just in the hotspot regions or is that everywhere?
So we're still trying to figure that out, Kate. So we know that for phase one, people who are receiving what the government called home health care were supposed to be part of phase one. Many residents who contacted our office, who in our minds didn't. We have heard from the city of Ottawa and the logistics people for the city of Ottawa that they will have a mobile vaccination strategy for people with disabilities who are literally, in some cases, bedridden, and in one case with which I'm familiar, like since last March, But, those services haven't been rolled out yet, not in a systematic way. So we've really been focused on these large vaccination centers, age-based, made total sense for the long-term care homes, workers in those homes. But now I feel we're in this moment where we're vaccinating 70 and over, 65 and over, 60 and over, and people who have contact with hundreds or thousands of people in major service occupations who are younger are not getting vaccinated. And that I'm glad the Premier made the change for the GTA, but guess what? There's 1 million people that live in our city too, and we have those needs too. And so there's that piece. And then on the disability piece, yes, I mean, I have been trying to tell the minister, Mr. Elliott, that other countries have been triaging people with disabilities right up near the top, because the evidence is clear there. Higher rates of infection, closer contact with contract workers, many of whom are not given proper amounts of PPE or support. It's just an awful vicious cycle that we've been trying to prevent. So that vaccination debate continues. And we're not going to let up. I think we've just gotten a huge shipment. I think it was 2 million of the AstraZeneca vaccines that have just arrived in Canada. Ontario's getting a big share of those. I don't know what you guys heard, but I heard before getting on our call that we're getting close to 1 million vaccines in freezers. I mean, whoa, okay, come on. let's get moving here, right? Let's get moving with some of this, particularly for people with disabilities who, many, particularly in congregate living in group homes, they've been living with a significant amount of fear for a long time. And that's not the kind of Ontario I want to live in. So I think if we all push hard on the vaccination front, we're going to see more opportunities for people with disabilities. We're a bigger movement than people realize. So there's 2.6 million people in Ontario who physically identify as having a disability. Connected to that 2.6 million are friends and family members. And there are 14 million people in the province. So we're, we want to talk about a significant lobby. We are a significant lobby, and we should be using every little bit of that influence. Because I can't even, it's a whole other conversation. I'm horrified with what happened in our long-term care homes with the workers in those homes. We took action recently to address some of that, and we see the results. Infection has gone down. Well, okay, it's time for us to look into other real high needs areas right now. And I think, people who work with folks with disabilities, people with disabilities themselves, that's a major essential
and
workers.
And caregivers, that was going to be my next question.
Yes. Yeah.
I mean, I know from my group of parent friends, there's a lot of fear there, right? If we get ill, I'm not even talking about dying, but if I were to get very ill and needed to sequester myself in my house, I've got 2 children with pretty high level of need, and there's not really anyone who can step in, especially during a pandemic, to help take care of them. So I hope that we will see some priority given. I mean, I'm still hoping teachers and other essential workers are also prioritized, but I do hope that that caregivers will receive some kind of priority as well.
Make a great case. I agree. Would it even be possible, Kate, for you to sequester yourself?
Probably not. No, I mean, you know, you and I talked this morning. My little guy doesn't understand. I have a nonverbal autistic child. He doesn't understand what COVID is. If I was in a room and we locked the door, he'd be on the other end screaming and yelling for me. And I mean, it would be so difficult. It would be so hard. I would probably have to leave and go somewhere else. And I don't even know where that would be. It's, it's so, and then the idea is if I have it, they may have it too. And they may not be as sick as me, but they might need to be being taken care of, or my husband. And what about if you don't have a husband, or you are a single parent? I mean, there's just so many variables here that would be so awful. So I'm certainly anxious, and I'm really looking forward to when I can get my poke.
Yep. I saw Pat got his, Kerry.
He did. As an optometrist, he got his.
Very happy for him.
Yeah.
Very happy for all you guys.
Well, we are getting close to the end of our time here. In fact, I think we've gone a few minutes over what we said we were going to have you, and I know you've got a busy day ahead of you. Any last questions, Kerry? Any last?
I'm okay to let Joel go if Joel needs to go. But we're so grateful to have had him sit with us today and just listen to us rant and talk to us about where we need to be going on this and where our head should be at.
We have at least 3 topics we didn't cover. So Joel, if you're up for scones another day,
Are you kidding me?
I'd love to have you back.
What kind of question is that? Of course, although I feel that it has to go back to you guys. I feel like I should be doing some baking or procurement of scones and stuff. We have some great scone bakers in Ottawa Center. I can bring some out your way. It would only be fair.
Scone witch. Mm.
Oh, that's one of them. Absolutely. Around the corner from our house.
Around the corner.
Life of Pie, which is another one.
Oh yeah.
Yes, they're great.
They make some incredible scones. So let's do it, and let's keep the troublemaking going. And all of you folks watching out there know that every little bit of advocacy you're doing, it's working. So please keep it up. And stay safe. Stay safe, everybody. Please, pretty please.
Yes, thank you. And thank you, Joel, for taking the time. We just love you to death. And you're so fantastic for our community, and we're lucky to have you. So
we are.
We thank you, everyone who's tuned in, and we'll take a look at the comments, and Kerry and I see if we can answer any other questions that we might have missed you. So great.
Take care, friends.
Thank you again, Joel, and we will see you soon. Thanks so much.
Bye for now.
Bye-bye.